Hello and welcome to another episode of Let's Talk Health. Today's session will be on common gynecological issues, and to discuss this, we have with us Dr. Radhika Valnavarti, Senior Consultant, Obstetrician and Gynecologist, Citizen Hospital, Hyderabad. Good evening, Doctor. So, before we start with our questions, I request you to give a glimpse of what your expertise to our viewers.
I'm working in Citizens Hospital for the past 10 years and overall 15 years of experience in varied field of obstetrics and gynecology. My keen interest is on encouraging women for natural childbirth and also helping women to lead a healthy lifestyle so that the healthy lifestyle can lead to overall, good health upkeep of the women and throughout their ages through the, from young age towards the menopause.
Starting with the questions, Doctor, my first question would be what are some of the most common gynecological issues that women face?
Common to the clinic, the patients that come to me are with one is irregular periods and then heavy bleeding during their menstrual cycles, vaginal discharge, and also itching in the private parts and urinary infection and other urinary problems, and also some pelvic pain. These are the common symptoms.
So my next question is, Doctor, can you discuss common menstrual health issues and the impacts on women well-being?
See, when we come to the menstrual problems, the common problem that women faces, as I already told, some women have excessive bleeding during their menstrual cycle. That is, it could be more number of pads, or that means the bleeding that they have could be heavy, or they could have it for more number of days. And also some women can have passage of clots. So that leads to loss of blood and anemia, which leads to overall health issues. They become weak and tired. And that is one of the common issues that women face. And other thing can be irregular bleeding, like, bleeding in between the menstrual cycles, where the common reason can be some infection or, other problems like some cancers which are not detected. These are the common things related to menstrual cycle. One more thing is they could have irregular periods. That is, they may either be very early or late. They would not be getting like every month. They would get once in 2 months or 3 months. That is also a very common problem, which is also associated with overweight, lot of, stressful lifestyle, associated PCOD and other hormonal conditions. These are the common menstrual problems that women come to the clinic.
So my next question is, Doctor, what are some signs that indicate a woman should seek medical advice regarding her menstrual cycle?
Yeah, especially when her normal menstrual cycles are, it happens like the frequency is 21 to 35 days. If it is earlier than that or the period is delayed more than that, then she needs to seek advice to know the reason. And also if the bleeding is very heavy, like so as to have anemia, and she'll have effects of anemia like tiredness, weakness, being absent from the work because of the weakness, heavy changing of pads more than 6 pads per day with clots, and also having bleeding more than 7 days. And having intermenstrual bleeding, all this she has to seek medical advice so that appropriate tests can be done to diagnose and give proper treatment.
The next question is, Doctor, what are the key aspects of reproductive health that women should be mindful of?
Yeah, so the common things that they have to be mindful of is the reproductive outcome is good in younger women. So age is one thing they have to be, mindful of. And other thing is lifestyle issues like, overweight, obesity. These do affect the hormonal changes and then their period cyclicity. And then that can affect their reproductive health associated with issues like PCOD. And other thing, even the current, the amount of stressful lifestyle the women are leading, that also can affect the reproductive health. And already pre-existing medical conditions like diabetes, thyroid issues, and hypertension, other things can also affect the reproductive health. These are the things that have to be taken care of.
The next question, Doctor, are urinary issues common among women, and what are the potential causes?
Yeah, definitely. Women face a lot of urinary problems. Common things are urinary infection, stress urinary incontinence, and also urinary urgency. These are the common things that women face. And what are the common reasons is, one is, when for the urinary infection, lack of proper intake of water, and then holding the urine for a long time, and also the sexual activity, And other thing is the urinary tract, that is the urethra, the outlet where the urine comes out, is very short in women and also is surrounded by vagina and the rectum and anus, which are more contaminated than the sterile urinary area. Hence, women are more prone for urinary infection. And other reason why stress urinary incontinence is more common among women is, one is during pregnancy because of the weakness in tissues they face, and during pregnancy and childbirth, the weakness of tissues can persist and can add on to the age-related tissue weakness, which can lead to the progression of these issues like stress urinary incontinence. So to prevent this, it's very important to do postpartum Kegels exercises or pelvic floor exercises. Okay, this is one thing. And other thing is, in elderly women, urge incontinence is very common because of the age-related changes, which have to be addressed.
Coming to the next question, doctor. How can women maintain good urinary health?
Yeah, so maintaining good urinary health, most important thing is drinking adequate amount of water, around 2 to 3 liters per day, and also avoiding urine whenever needed. That is, not holding urine for longer than required, and then washing after intercourse on a regular basis is one thing, and doing pelvic floor exercises after the childbirth to strengthen, and also continuing it and making it as a habit doing throughout their lifetime is what will be helpful.
So the next question is, doctor, what are some common sexual health concerns that women may encounter?
Yeah, the common concerns are, one is they usually come up with pain during intercourse, or it could be dryness in the vagina which causes discomfort. And for the pain during intercourse, it could be due to external vaginal infections which cause superficial pain, and sometimes disorders like endometriosis, pelvic infection cause deep dyspareunia or pain during deep intercourse. This is the common things. Yeah. So one is related to pain, and the other one is dryness in the vagina that can happen with a little, around 40 years of age or later due to the reduction in the hormones. That can be helped with some lubricants and also, some mental relaxation techniques that help in lubrication.
Next question. Pelvic pain can be concerning, right? So what are the common causes and when should women seek medical attention for such pain?
See, pelvic pain is not normal. Okay, so pelvic pain common reasons are due to pelvic infection, and then other thing is because of conditions known as endometriosis. These are the two common reasons for pelvic pain, which needs to be addressed because it can be very stressful to the woman, because it hinders in one is participating in the intercourse and in the day-to-day activities. And pain itself, it reduces either it could be their activity in work or in household activity. And when the pain is severe, definitely it needs to be addressed. You have to diagnose what it is and treatment has to be given.
So the next question is, doctor, what preventive measures can women take to maintain gynecological health?
Yes, a very question close to my heart, because I am very interested, rather than treating people after they are sick, teach people how you can take care and prevent and so that they are healthy. Okay, so first and foremost thing is maintain a good lifestyle, that is having healthy, good nutrition, and then maintaining regular physical activity in the form of yoga, exercise, running, whatever physical activity, and then maintaining very good mental health, that is stress-free life. These three things prevent 80% of the problems. And next thing, when related to prevention, do pelvic floor exercises to prevent or reduce incidence of prolapse and stress urinary incontinence is one thing. And also doing postpartum exercises helps in maintaining good back health, reducing the backache. Okay, and other preventive strategies for young girls and all young women, you can take cervical cancer vaccination, which is a HPV vaccination for preventing cervical cancer. That is one thing. And also, as a preventive aspect and early detection, do pap smear test regularly. That will help in early detection of cervical cancer, and also breast examination, self-breast examination and mammograph after 40 years.
So the last question for the session would be, sir, are regular screenings and checkups essential for early detection of potential issues?
Exactly. So I think as I already started, so regular checkups are mandatory for early detection, because in very early stage, there won't be any symptoms. Symptoms will only appear in the later stages. So if regular checkups are done, then cancers can be detected at very early stage, sometimes even pre-cancer, like doing pap smear after, in the when women start their sexual life. Every 3 years, if it is performed till the age of 65 years, it will pick up many of the cervical cancers so that we can treat them even in the pre-cancer stage. And the other thing is self-breast examination by women after 25 years of age every month, and annual breast examination clinically. And from 40 years, they can go for mammography for early detections of breast cancer, and also can do a annual ultrasound to check for any ovarian pathologies.
Thank you, doctor, for your valuable time and inputs. So with this, we conclude today's session on Let's Talk Health. We'll be back with another episode. Till then, take care, be safe.